treatment of keloid scars. Is there treatment for keloid scars so I can tattoo over them? Well, is there treatment for keloid scars? Yes. So there are several treatments for keloid scars. Keloid scars are lumpy, raised, often red or darker colored skin, abnormal scarring, and they're difficult to treat, and they are prone to certain skin types, certainly for darker colored skin, Afro-Caribbean skin. Certain areas it's prone, earlobes, shoulders, sternum, are areas that are prone to keloid scarring. They're difficult to treat. And but there are ways you can treat it. You can, on a simplest level, massage. You can use silicone in the form of either sheets or gel. You can perform steroid injections. Those are the mainstay of treatment. For the more aggressive or problematic ones, you can cut them out, but then you worry you're going to get an even bigger one come back. And you can even use radiotherapy and other sorts of modalities for keloid scars. So there are things you can do for keloid scars. So you can treat keloid scars, but the question, can you treat keloid scars so you get them tattooed over? Blimey, I wouldn't, personally, I wouldn't. And the reason I wouldn't is because even when you treat it, you aim to make it flat. And but there's often a bit of a bump. And it's the bump that, I'll say I wouldn't. I mean, it's the bump that's the problem. So if you tattoo over a non-flat surface with a bump, unless you're trying to incorporate it into the tattoo, I don't know, it might not be the result you're after. So I think the other thing is keloid scar can come from a very minimal trauma. So if you're prone to keloid, you can get a spot or a chickenpox, scar or something like that, or the BCG injection or some minimal, or ear piercing, minimal trauma to get the keloid scar. So I would just be worried about having a tattoo. Personally, I'm worried that could that trauma cause keloid. So I would be worried about doing. So can keloid scars be treated? Yes, so that you can tattoo over them. Not sure I'd be encouraging you to tattoo over it, because I would be avoiding having any needles stuck in my skin if I am prone to keloid scars. Now, if it's a hypertrophic scar, that's a different situation. That's a scar that's had delayed healing, got infected, had a problem, and has ended up with a red, lumpy, raised scar. Then that might be possible to be revised, because that might not be your body forming the scar, the ugly scar. It might be the fact that you had an infection or a delayed healing. But if you had normal healing and you got a proper keloid scar is traditionally bigger than the original scar. So that's one of the hallmarks of a keloid scar. So you can end up with an ear piercing, which is a tiny little scar, because it's just a hole, turning into this massive, great big scar, which is much bigger than the original scar. I said scar a lot there, didn't I? I hope that makes sense. But anyway, yes, keloid scars can be treated, but I wouldn't necessarily be going on to the old tattoo afterwards on a personal basis. I wouldn't, but Karen's first time here. Yeah, we should have like a star or ring a bell. I haven't got a bell. First time. It's all right, Karen. Welcome. Thank you for coming. Do you know if fractional laser work, burning the scar of skin, is successful in inducing the appearance of scars? T-gank you too, Karen. Well, in my opinion, now, disclaimer, Karen, I don't do laser. But in my opinion, laser is good for red things. So laser is good if the scar is persistently red, and it can help to target the red pigment and to make it less red. Now, the problem is scars are often / usually red to start off with, and then they settle. They can take 6 to 12 months to settle, sometimes even longer, 18 months or more. So they can take time to settle. So my advice is normally moisturize and massage to help the redness fade, help the firmness to settle, and let them settle. And usually they do settle pretty well on their own. But if you do have persistent redness, then you might want to think about laser to target that redness. But it's not needed as often as I think people think. They often think, oh, if my scar's bad, I'll get some laser. But having said that, I don't do laser. So maybe if you spoke to a laser person, they'd be thinking that there'd be more applications for it. But that's my view of laser and scars. Being here for that, I hope that's answered your question okay. Do you recommend silicone strips for scarring? And what about a roller ball for massaging product into or lymphatic drainage? Well, Donna, funny you should say that. Because we have the dual action scar gel now available from the Stanley Plastic Surgery website and distributed from my home because I've got them all over there. We also offer the smaller scar. Where's the camera? Oh god, scar gel there. So the 6G or the big boy 15G, and this one, so the big boy has got like a rollerball thing on it. See, it's got a rollerball. Check that out. That is product. This is what we want. That's got a rollerball on it, so that when you apply the silicone, the rollerball massages. What's the question? Do you recommend silicone strips for scarring? So these are gel. These are both gel. So silicone comes in gel or strips. To be honest, TBH, I would say. Now they promote silicone. They probably say on it just for scar. Yeah, treat scars. They promote it for scars. They say that it's for any scar, help scars, because I think they want to sell it to people, because that's a big market, isn't it? Scars. To be honest, I would say to you, it's really for problem scars. For most normal scars, I think any massage or moisturizer, any sort of moisturizing cream. We also have. Oh, it doesn't know. I'm not going to go on. We got QV cream. Anyway, just whatever moisturizing cream you got. To be honest with you, to be perfectly honest, for me, it's more the moisturizing and the massage that's doing it rather than the stuff you're using. So if you've got some hand cream that you normally use or some moisturizer, we do sell some moisturizer. But anyway, if you've got some moisturizer you like, then I'd use that, to be honest with you. And that's the main thing for scars. If it's a problem scars, by problem I mean red and raised. Now that's a hypertrophic / keloid scar. So if it's getting a bit red and raised, a bit hypertrophic, that's when the silicone strips come in. So silicone comes in. So silicone really is beneficial for problematic scars. And silicone comes in the form of strips or gel. The gel is good for areas like the face, for instance, ears, where it's a strip would fall off. You wouldn't want a strip on your head, because the strips are good for maybe the breast, tummy, because your underwear can hold them in. I don't particularly recommend silicone strips for scarring, but if you have got problematic scarring, if it's red, raised, itchy, they can also help with the itch, then it is good. I don't think you were talking about the rollerball in this one about massaging product in, but massaging product in is good. And I think the fact that this has got inbuilt rollerballs, this is why we've got it at the clinic, really, because I thought that was really good, that rollerball applicator, because it gives massage as well as the silicone. But yeah, massage is good. So if a rollerball type of device to give a bit of pressure, obviously you've got to wait till the wound's properly healed. You don't want to be uncomfortable, then that's good. Lymphatic drainage also is good, and lymphatic drainage, not so much for scarring, but certainly for healing, is good. Manual lymphatic drainage, excuse me, is a good thing to do. Yes, I do think that is good, Donna. Karen, thank you. Your first timer, Karen. Nice to have you on board. I ask, as I'm a massage therapist, so hoping to help lymph drainage at home as much as I can. And ooh, look at that gel. Amazing. How often do you use that for? Woo-hoo. Yeah. Available online, dispatched from Stino Towers right here. So you massage, yeah, I think massage is good. I think it's good. I think manual lymphatic drainage is good at home. And what was it? Look at that. Sorry, what was the question? At home, as much as I can. Yeah. How often would you use that for? What, the gel? It's only for problem scars, to be honest, Donna. So not particularly often. If I'm honest with you, Donna, if I'm honest, I mean, it's just you and me here, but it's only needed for red lumpy scars, keloid hypertrophic scars. As I say, I think they want to sell it to anyone with the scar, and but the evidence, in terms of medical evidence, the evidence is strong for lumpy red scars. The evidence isn't great, and what they do is they show you photos of a scar. They say 6 months after using this, and the scar's gone, and you're like, well, hold on a minute. 6 months after massaging with normal stuff, or even 6 months with doing nothing, a lot of scars disappear. So for me, I don't think the evidence is strong for normal scars personally. There's no problem with it, but the evidence isn't strong for using it in all scars. Olivia, scar gel. Oh, how much is a scar gel? Oh, God. Got no idea, Olivia. It's on the website. Sorry. I don't know, 30 quid or something? I made that up. I don't know. Sorry. It's on the website. Anyway, it's on the website. I won't do it now. Sorry, Olivia. I'll let you down. I don't know what it is, but you can get it from other retailers like Amazon and, well, I shouldn't mention the name, Boots, Chemist Pharmacy. It is available over the counter.